So shared decision making, I believe, is a very important tool in clinical practice. And I do think there's a lot of confusion about what it is. I think that when I first learned about shared decision making, I thought I clearly was using this correctly in my clinic because I would give the patient two options and they get to choose one. So that's shared decision making, when actually that is not quite what it means. What it means is that you present multiple options to the patient in a way the patient can understand those options, and in a way they can understand the risk and benefit of each option. But when you present these options, sometimes there will only be two, because you really have to also layer in best evidence. So, for example, a patient comes in to see you and they have migraine attacks and they're frequent enough, they're causing disability. So you come to the idea as the provider that, hey, I think this patient needs to be on prevention. The first step in shared decision making is to get an assessment of the patient's goals by listening to their story and kind of reflecting it back to the patient. So I hear that you're very disabled by your migraine attacks and you're missing quite a number of things in life. I feel that based on this disability, you might do well in reducing the frequency of migraine, because at this time, there's no cure. There's nothing I can do that's going to make this go away completely. And let's talk a little bit about this disease. So just having some basic education to the patient about what this disease is, and there's not a cure, because that's step one. They often come in and think, I'm going to do something that's going to make it completely go away. So that's the first part of the shared decision making: education about the disease, understanding about treatment options, and then moving on to, okay, if we are going to try to improve this disease process, there are ways we can go about this. We can start you on medications. We should probably make some lifestyle changes. We can think about behavioral therapies to layer in, and at what pace and at what way we're going to do all this is a little bit based on the patient and their lifestyle and how much they can handle, and also how aggressive the disease is. Somebody who's having headache every day and migraine 3-4 times a week, if they leave the office and we've only discussed lifestyle changes, that really might not be enough to get them back to functioning within the next few months. But if that's all they really are feeling comfortable with, well, then we've had that discussion that I feel like they might need more treatment. They understand there are other treatment options there. I understand they're anxious about trying that before they make the lifestyle changes. Then we might set a follow-up in the next month, as opposed to 3 to 4 months, because I want to check in and make sure that they're able to meet some of those lifestyle changes in a short amount of time. So that's the way a shared decision-making process goes. The entire visit is based on a back and forth dialogue with the patient, every step of the way, making sure they understand the disease and the consequences of the decisions that are made, with you providing education about each decision step. It can take time in the beginning, but I think the better you get at it, the faster it goes, the more satisfied the patients are with the visits, the less in between phone calls that we receive, and the more engaged the patient is in their treatment, the more likely they're going to follow through. So there's a sense that adherence and perseverance on the medication, that the patient remains on treatment, is much better because they chose that treatment option. You didn't choose it for the patient. So there's a higher chance that they made this choice really with thought involved, that they're excited about that choice. There's a better chance that not only will they stay on the choice, but if there's a problem, they will get back to you and that change will happen sooner rather than later.